Hey everybody, welcome back to Me Time. I am your host Megan, and today I'm going to be discussing the nurse practitioner transition into practice and specifically talking about ways that we can make that transition a little bit smoother. So this is the first video of hopefully multiple videos that we're going to be discussing different topics about how to have a smoother transition into practice. I'm also planning on having a few guests on to talk about these points to give some context to what we're going to be speaking about in these shorter video series. And today specifically, I'm going to be speaking about the onboarding process and why the onboarding process is so important for nurse practitioners to talk about before you accept a position. So before you accept your job, these conversations should really happen before you sign that paperwork so you know how to mentally prepare yourself for that position when you start. I think we all know that the first couple of years as a nurse practitioner can be quite difficult, and there's lots of videos and content out there about the fact that it's a difficult transition, but there are a few things that we can do as providers to help make our transition go a little bit smoother, and so we feel like we have a little bit more control over that, because a lot of it we can't control and a lot of it is going to be multifactorial like we said. But if we can find ways to fit our own needs for our growth, the better off we're going to be in the long run. So I want to take some time to reflect on our registered nurse orientation when we were nurses and just started out as nurses, because I feel like why the NP transition is so jarring is yes, it's multifactorial, and yes, they're very two different positions, but nurses, as registered nurses working in the hospital, your orientation is very different than it is as a nurse practitioner when you go into practice for the first time. So I'm speaking to hospital nurses because that's mainly my experience as a hospital nurse, and also I think a very relatable way to discuss it. But as a nurse, when you graduate for the first time and you're working for a big healthcare organization or a hospital and working on a unit, you tend to have a very structured orientation, or specifically a whole new grad cohort where you're with other new grads going through the same program that's set up by the organization. This whole type of like a residency type program or an intensive orientation is to give back to you so that you feel like you have the tools and support so you can be a successful nurse at their facility. Also, they want to invest in you so that you stay and that you like it and that you continue to choose to work there. They want to focus on every aspect. So they focus on, yes, the skills check off, understanding hospital policy, but they also focus on creating mentor-mentee relationships, making sure that you feel supported and have a safe environment to grow in, and also feel like they're fostering continuing education. So most of the times you're still doing some type of practice improvement project for your unit, or you have to present something at the end of your orientation phase to show, to provide your unit or your hospital with ways that they can improve, or show them that what you learned over the last couple of months. So that is just a quick overview. So a couple things stand out to me from the RN perspective. It's structured. Usually it's over a longer period of time for the new nurse. There also tends to be an educational component to it, and there's a mentor-mentee relationship. So that's really important. So I think as nurse practitioners that are new, we can take some of those tools and set a little bit of a guideline for us as new grad nurse practitioners so that we can use some of these skills to feel more comfortable and successful as we're transitioning into the nurse practitioner role. So as a nurse practitioner, the scope of what orientation is going to look like, or they call it the onboarding process, it is very different, and it will differ from practice to practice. So there are NP residency type programs which are very structured. They tend to be, I would say, on average about a year time frame, where you're doing education, you're having more clinical practice experience, where you're getting to do more clinical rotations that are supervised. You're more independent than you were probably in school because you're licensed to do so. And it's set up that way so that it's over the year, you're going to feel more prepared to step into practice than you probably would have as that first day as the resident in that NP residency. So that's the extreme of like the most structured, well-balanced type of orientation into the NP role. Now, on the other hand, you have some practices that you'll interview with that will say, hey, yeah, we'll do a quick onboarding. You get 1 day of shadowing. We'll have EMR training. That's pretty brief, but you'll figure it out right away. It's not that hard. And within the first week, we expect you to be up to 100% of your patient load. Now, if you apply to a practice and that's what you're hearing from your hiring manager or your medical director, and you are a new grad, I would not take that lightly. To me, that is a red flag. The only reason why I would say that it was not a red flag is if you did your clinical practicum experience at that particular clinic, you already understand the patient population. Maybe you know your patient population very well because you did your practicum there. You might know the computer system, but if you're expected to ramp up very quickly, that is going to add a lot of an additional stressors for you and your team, especially if you don't know your team or don't know if you're going to have the right amount of support. Are you going to have a medical assistant? Are you going to be working with an RN? What is your team? Are they hired? Are they ready? Are they trained? Do they have experience? This all plays into how successful your transition may be. I would say most onboarding processes probably fall somewhere in between that. So between no training or minimal onboarding experience to maybe having a few weeks. And then rarely are you going to have that residency style. But if you're looking for that type of residency style, you need to look for a practice that's really going to support that. Or maybe look into applying to practices that are more NP run, that have dealt with a lot of new grads before, because they probably have a structured way that they like to transition nurse practitioners into practice that are probably different than the average practice. So let's talk about ways that you can increase the likelihood that you're going to be successful transitioning into practice. So one thing that I think could be helpful when talking to hiring managers is asking about the onboarding process and what their expectation is. So sometimes if they've never hired a new grad nurse practitioner before, they're going to go ahead and ask you, hey, we haven't hired a new grad. What do you feel like you need in your experience to be successful here? So they might point blank just ask you. And if they do ask you, we want to be prepared for that answer. So I would come up with, how many weeks you feel like is appropriate to be at a reduced schedule. When we talk about being at a reduced schedule, usually that means you're seeing 50% of your normal schedule. So if you're normally expected to see 20 patients a day, you're going to start seeing 10 patients a day, and you're going to be at that schedule until you feel comfortable to move up to 75%. That date can be set ahead of time or can kind of just be on a rolling basis to see how you're doing at the 50%. How is your team doing? Do you feel comfortable going up to 75%? I would say you probably need at least, if you're brand new, at the very least 2 weeks on 50% to really feel confident. I would encourage you to take as much time as you need. It is oftentimes this time at the beginning of your transition and starting a new job that it's not just your patient load that really matters. You are figuring out the system, how to document, how to have muscle memory in the documentation if you're using a new charting system, because that can take a lot of time. You don't want to be taking your work home with you as much as possible. So the more efficient you can be within their system, the better off I think you're going to be. Also, you're working out the nuances of your team and your teamwork. How is your team communicating? You're also trying to figure out how the clinic flows. What are resources that the clinic has? How can you utilize community resources? Who can I refer to? Where are the equipment? Where is the equipment that I need? There's so much happening in that first few weeks that oftentimes you really need that 50% to feel one, less stressed, and to really get to have a well-working system before you get up to 100%. Once you feel good at 50, bump up to 75%, stay at 75% until you feel like you're ready to go to 100. Most people, I would say, probably don't feel ready to go to 100% when they do go to 100%. And sometimes you need to come back down to only have 75% of the patient load. But I feel like most organizations are willing to work with you. Also, if you feel like the process is going too slow, usually employers are super open to you saying, hey, I'm willing to take on more patient loads. My team is ready, or I am ready, but my team is not, vice versa. So having that conversation and constantly checking in, maybe every week or every, few days to see how the onboarding process is going, can be helpful. So having an expected timeline makes a difference, because some clinics are not going to go off of 50%, 75%, 100%. They might say, you're expected to see as many patients as you can, but we'll give you 30 minutes for every visit. That way they're thinking they're giving you more time and more support. However, if you're supposed to be seeing 26 patients a day, that means you're still seeing 13 patients day one. I feel like that's a lot on day one, especially if you're not super comfortable with like the charting system, or if this is your first job out of school. Just ask for a slower onboarding. That'll be beneficial for you in the long run. You'll be a little bit happier. You'll have more time to adjust. I also recommend, if you have the opportunity to, is to shadow. Most of the time, they do provide some shadowing. So shadowing doesn't have to be for weeks on end. It's not going to be for weeks on end, and it's not supposed to be for weeks on end. It's meant to be there. So one, to decrease your own anxiety so that you're ready to start seeing your own patients. But it's also there so you understand the flow of the clinic. You understand the expectations. You understand how the team runs. You get to see firsthand how other providers are handling care coordination. So it's really there for you to observe, but to also learn from them. So I would take advantage of any shadowing opportunities that you can. It sometimes feels a little weird or clunky, but it's a good opportunity for you to observe and be like a sponge. So you can absorb some of these maybe how the team dynamic is. And so you can bring that forward into your team. Also, take note of the charting system when you're shadowing. A lot of times it's to get the nuances, the ins and outs of charting. Is there shortcuts to do something? Can you take this time to create your smart phrases? Definitely utilize this time. So that's kind of the whole like onboarding process and timeline. Again, I would highly recommend taking a position that allows for like a slower onboarding. I would not accept your first position where you have zero onboarding and you're expected to see a full patient load. That's difficult for even experienced providers to do because it doesn't give you time to adjust. So take that into consideration. So when you're asking about the onboarding process and you're a new grad nurse practitioner, I would also ask specifically for a designated mentor. So a mentor-mentee relationship. So this is somebody that you can go to with questions, who is expecting you to go to them with questions, and they are going to be very open to your questions because they're expecting it. So having one or two people designated to go to if you have questions can be so helpful. One, because if you have a question about kind of how the clinic flows, you have someone to go to and they're expecting it. You don't feel awkward going to them, and they hopefully will be very receptive to helping you out. This is also helpful if you have questions about clinical scenarios. I do recommend having protected mentor-mentee time. What that means is that you're meeting with them very frequently. So you're maybe meeting with your mentor-mentee once a week or twice a week at the beginning if you need to review patient cases, patient scenarios, or just to kind of chat with them about how things are going. You want protected time. And what I mean by that is that try to have it not be your lunch hour. Try to have it not be in your admin time. However, if they offer it in those timeframes, take it, because it's better to have those check-ins than have nothing at all, because I do think it's so important for professional growth and development, especially as a new grad nurse practitioner. So have a designated person, because that can be helpful not only for clinical growth, but for your personal growth as well. And I think it's kind of nice sometimes to have more than one, because that way you get a different personality. But having those frequent check-ins can be very helpful in the future for new grad nurse practitioners. So mentor-mentee relationships. You want to ask specifically about the onboarding process, and you want to be vocal. You want to advocate for yourself. Half the time, these employers want you to be successful, so they're trying to ask you what you feel like you need. So if you are going into a specialty, let's use women's health, for example, and they have some procedures in women's health that you're uncomfortable with. They're not uncomfortable with, you just haven't had much experience, but you want to learn how to do them and be able to do them in practice. For example, if it's IUD insertions and you only had a few IUDs in school, but it's been a while since you put an IUD in, you might want to say, hey, I'm excited to have this position in this role. I'm interested to see if we can set up a skills day where I can do nothing all day but insert IUDs so I can get more comfortable with that and have my mentor there to help me if I need it. Or if I run into trouble and need advice, they're there to help me out. If you're vocal about that, they'll know, hey, Megan really needs a skills checkoff day where she just gets to do skills all day and practice them and have somebody there if she has questions. That is a safe learning environment, and that is one that you want to look for if you're going into a specialty role. Now, I would say most specialties, like if you're going into ENT or GI, they're probably going to have a little bit more robust type of onboarding. I would think most specialties do, but if they don't, you definitely want to ask specifically about the procedural skills that you're going to be expected to know how to do. And usually there definitely needs to be some time to learn that skill. So definitely ask what that would look like for you. So these are some tips that I have for the new grad nurse practitioner. I hope you found this helpful. Again, onboarding is about taking time for you so that you feel comfortable transitioning into that role as a new grad nurse practitioner. It will take time. You probably will not feel ready when you're moving from that 50 to 75 to 100%, but you want to just make sure that you're having the tools so you're able to be successful. So advocate for yourself. Make sure you ask these questions in your interview, and best of luck in your first new job. So thanks again for tuning in. This is the first of a few episodes about the transition into practice as a new grad nurse practitioner, and we'll see you next time on To Me Time.